once the patient has a condition, the information belongs to the patient because it's for his or her outcome. And that information will determine what will happen in the future, and the treatment or the follow-up of that patient will depend very much on that information. Whether he or she wants to share or follow the recommendations, that's another question. But for that, the patient needs to be well informed and understand which are the consequences of that condition and what are the consequences of having a follow-up more strict or less strict, or performing a test or performing an intervention. And this needs to be always shared with the patient. It's a shared decision between the patient and the physician that is in charge at that moment. Of course, that there can be multiple disciplines, so sort of bridging a discipline. The patient that can come, for example, with a severe aortic stenosis and was discovered when a renal failure was diagnosed and needs a transplant, and what do we need to operate first, whether it's the aortic stenosis or the renal transplant. That's a very frequent discussion that we have in our clinical practice. And the patient should be at the center. And the discussions and the decisions should be shared with the patient. And the patient eventually, as I said before, is the driver of his own or her body and needs to decide what to do. Of course, if they don't have the knowledge, it's going to be very difficult for them to decide. And I don't pretend that the patients decide themselves, because we know the consequences. But by explaining the consequences of each condition, the patient can understand better why we recommend one intervention or the other.